So we will get started. Thank you so much for joining us to talk about a topic I didn't think I would ever be talking about, adolescent substance use and COVID-19, our current pandemic. We're going to discuss the implications, risk factors, and prevention regarding adolescent substance use. We are so thankful that GNCY is hosting this. GNCY is the Glenview Northbrook Coalition for Youth, and we are a substance use prevention coalition that works in the Glenview Northbrook communities. And we are really excited. This is actually our first webinar. So I apologize if there are any technical issues as I'm trying to click through my slides and they're not actually clicking for me. So I apologize. Let me see if I can get this figured out so you guys can actually see the presentation. Hold on one second. There we go. All right, so back to GNCY. So these are a number of the community partners that we work with regularly doing our various initiatives in the community. And like I said, we are really focused on preventing substance use among our adolescents, really focusing on those middle and high school students and working with lots of these different partners in doing so. Definitely the schools throughout Northbrook and Glenview, police departments, libraries, a number of the youth serving agencies, some of the student groups, which has been really fun. And yeah, like I said, this is our first webinar due to not being able to actually do things in person. So thank you so much for joining us. My name is Erin Teggy. I work for Peer Services and have been a part of the coalition for a number of years now, and Peer Services is one of the local substance abuse prevention and treatment agencies, locations in Glenview as well as Evanston. I've been doing substance use prevention for almost 6 years now in our communities, really focusing on Evanston, New Trier, Skokie, Glenview, Northbrook, kind of the whole North Shore area, and working with lots of different folks on doing substance abuse prevention for our youth. Just a few housekeeping things to take care of regarding this webinar. It is being recorded and we will have it available to those who could not join us, or if you have to leave early, you'll be able to get access to it as well. If you have any questions that pop up throughout the presentation, please use the Q&A function that's located at the bottom of your screen, and we will hopefully have time to get to them at the end of the presentation. If there's any questions we don't have time for, or I don't have answers to, I will definitely email those out to those who are on the webinar today. We will be sending out an email to those of you who are present during the live webinar so that you can have access to the PowerPoint, because there are resources and other pieces of good information that hopefully you will want to have access to after the webinar today. And then lastly, we will be sending out a short survey just so that we can get some feedback on how the presentation went and any ideas or future topics that you may want information on. So what we're going to talk about in the next hour is COVID-19, what we currently know in terms of health effects. I'm not a medical doctor, so I take all of my information pretty much from the CDC and other reliable resources, but we're going to talk a little bit about some of the current known effects when someone does get COVID-19. Then we're going to talk a little bit about substance use, and specifically adolescent substance use, and the known health effects that we see there when an adolescent or teen does engage in substance use. Then we're going to talk about the intersection between those two. So not only how COVID-19 could potentially impact adolescents using substances, but also if a teen is using substances, how that could put them at different risks if they do end up getting COVID-19. We're going to talk a little bit about risk factors of substance use. These are going to be some higher level overviews. We could do entire presentations on each of these topics, but specifically talking about stress and anxiety among our teens, any sort of trauma, and the current social isolation that many of us, including our teens, are facing. Then we are going to go through some information on what you as a parent or a professional working with teens can use. There is an acronym that we're going to be going through called FACE COVID that gives some tips and information on how to work with teens, well, not only taking care of yourself, but then helping our teens take care of themselves. And then some other tips for parents and professionals. And then lastly, some really great resources that are out there for a lot of virtual type things that are out there. So that's what we're going to be talking about today. So what we currently know, and I know there's a lot on this slide, took it straight from the CDC, but we definitely know that there are certain people who are at higher risk if they contract COVID-19. Those who tend to show more significant symptoms might require more hospitalization or more intensive treatment. And I'm not going to go through and read all of this, but ones that I want to definitely highlight that we'll be talking a little bit more about throughout is definitely paying attention to those who have some sort of chronic lung disease, something going on with their respiratory system already, those with pre-existing heart conditions, those that have weaker immune systems for whatever reason, and some of the other pre-existing conditions that make getting COVID-19 much more significant than those who are, completely healthy. So, some of these definitely don't apply to our teens. They're not 65 and older. They're not living in nursing homes, which is a good thing. But, some of these other risk factors, could definitely be something that our teens have. So it's definitely good to know that these various things are important to keep in mind when we're talking about this particular virus. There's two different aspects about this virus that I want to spend a little more time talking about, and it will then go back to relating to substance use. So definitely lung health. That's definitely what we hear the most about in the news and from the medical community as to how it is affecting people who get COVID-19. So obviously that lung health is a huge deal. So not only, are people getting pneumonia, but the one that we're hearing most of is kind of that progression from pneumonia, that acute respiratory distress syndrome, which is definitely a form of lung failure, which is what is leading to, those needing to be on ventilators and getting some pretty significant treatment. They're also finding that sepsis is also one of the consequences that some people with poor lung health are getting regarding this virus. And we definitely know sepsis can be very dangerous, since then the infection spreads throughout the bloodstream and can travel throughout your body, which can obviously be pretty significant. So we hear a lot about how this particular virus is impacting the lung health. What we don't hear about as much, but there is starting to be a little more research about, is heart health. So doctors and medical professionals are seeing more cardiovascular complications from someone contracting COVID-19 that they hadn't necessarily seen before. And it could be an increase in your risk for a heart attack that is brought on by respiratory infections. When the body is fighting an infection, has fever, inflammation, it can destabilize any previous fatty plaque that's found in your heart, which could then lead to heart issues or heart failure or potential heart attack. And they're also finding that COVID-19, because of, again, going back to those lungs, it can decrease the oxygen level in the body. This causes a lot of stress on the heart muscle and can actually mimic a heart attack, even though all of the normal, textbook signs of a heart attack don't exist. And so the medical community is starting to see Definitely not as severe as the lung health, but some of these heart aspects among their patients. So kind of switching over to those health effects of substance use. So we have a lot of information in the research about how substance use can impact teens or someone who is, an adult or has been using for a short or a long period of time. So we do know that smoking or vaping, so not just smoking traditional tobacco products like cigarettes and cigars, but vaping e-cigarettes, vaping cannabis, etc., can impact a lot of different areas of the body. So not only does smoking and vaping impact the heart, so it can lead to cardiovascular disease. It increases the heart rate, so it's making the heart work a lot harder. It impacts the lungs. Obviously, there's decades of research about how smoking impacts the lungs because it, when someone is smoking that combustible cigarette or vaping an e-cigarette, those chemicals and everything that's in there is getting into the lungs and really compromising the lung health of the user. So that is something that is definitely an important thing to think about right now. We also know that smoking and vaping causes cancer. One of the other things that the nicotine does is it decreases the effectiveness of the immune system. And so those who do smoke or vape are more likely to become sick if they are exposed to certain germs and certain viruses. So their body is kind of much weaker than someone who doesn't smoke. And then we definitely know it impacts brain development and impacts how the brain functions. So similarly with cannabis also acts as a stimulant on the heart. And so again, it increases that heart rate. And so when exposed to something that could be affecting the heart, like we just talked about with the COVID-19 virus, that it can make the heart work harder. Then you layer on top of that cannabis, which increases your heart rate again. You could be at a higher risk of having heart issues. Similar to the smoking and vaping, when you're smoking or vaping cannabis, you are, getting lots of stuff into your lungs, various chemicals, tar if you're smoking it via a joint, but lots of different things, other carcinogens, chemicals getting into those lungs and compromising that lung health. And then one of the other components of cannabis, which I think is really important now, is, for some people and for some teens, it does impact that mental health component. And so people who are using cannabis can be, more prone to feeling anxious or more prone to depressive symptoms or more prone to some more significant mental health issues like, schizophrenia, extreme paranoia, some of those more significant mental health needs. And so with everything that's going on, and when we talk about mental health a little bit later, it's something to remember that, all of our teens right now, plus all of us adults, have a lot going on and is likely impacting our mental health. And so if our teens are then using cannabis when they're already stressed or anxious or depressed, then introducing cannabis and using cannabis could then exacerbate some of that stuff. Alcohol absolutely impacts the heart. It is a depressant, so it actually slows the heart down. But those who use alcohol significantly long-term, someone with like a substance use disorder for alcohol, more prone to high blood pressure and stroke and things of that nature. It impacts the liver. And again, this is more of a chronic user. And then just like nicotine, alcohol does weaken the immune system. And the body is then more prone to sickness and illness and not able to fight various viruses as other people might. There's a few other drugs that have kind of popped up with this intersection, opioids as well as methamphetamines. So, one of the things with opioids, it is also a depressant, so it does slow your breathing. It decreases those oxygen levels in your body. It can lead to respiratory disease. And so those factors, along with what COVID-19 does something to keep in mind if someone is rightfully taking an opioid, because there very well could be teens who are rightfully prescribed an opioid right now, or if they're misusing an opioid. So things to consider there. And then methamphetamines, luckily we don't hear too much of our teens using meth in our community, which is great. But one of the things that the medical community is seeing is that because meth constricts the blood vessels and then makes the heart have to work harder to get the blood flowing through the system, that is one of the substances they're seeing that is making someone who has COVID-19, if they're also a meth user, there's more complications there. But like I said, luckily that is not a big issue for our teens in this community, which is a wonderful thing, but something to keep in mind. So now kind of talking about the intersection of COVID-19 and adolescent substance use. So this is a quote from Dr. Nora Volkow. She's the director of NIDA, the National Institute on Drug Abuse. And she's basically saying there's not a lot of information right now about how those with substance use disorders or those who are using substances, how that kind of intersects with COVID-19. I mean, there's a lot about COVID-19 that we don't know, and even less about those with substance use disorders or using substance use. However, based on what we know about all the different substances and how those substances can impact your own physical health, there's a lot of things that we can make, good educated guesses, as she says, about how those with those compromised health issues that come from a variety of those different substances make it even worse if they were to contract COVID-19 and can cause more serious complications. So there's definitely some information from some of the national agencies, as well as some of the world agencies regarding health. And the biggest thing is what the research is showing is because the coronavirus attacks the lungs, those who already have a, decreased capacity in their lungs or have some sort of respiratory issue are at greater risk. And so definitely those who are smoking or vaping e-cigarettes, because their lung health is more compromised, then they could experience, if they contract coronavirus, much more significant symptoms and might need more treatment. And again, those substances that weaken the immune system or cause heart disease or other cardiovascular things, again, smokers and those who vape, nicotine and cannabis, definitely are at a greater risk if they're confronted. And the CDC also has put out statements about tobacco smoking and the lung disease and how that makes things worse from a recovery standpoint if someone does get coronavirus. So definitely these places are all pretty much in agreement. If you're smoking or vaping and have a weakened lung health, if you contract coronavirus, you are definitely at greater risk. Also, the World Health Organization, they also put out a very similar statement regarding that, not just, our traditional tobacco products like cigarettes and e-cigarettes, but, looking at other forms of smoking, like, hookahs and water pipes and that type of thing. They point out, and since they're the World Health Organization, hookah is definitely more prevalent in other parts of the world and in certain cultures. But with a hookah, you do share a mouthpiece and share a hose. And so that is also one of the ways that smoking those particular items can lead to the transmission and sharing of the virus in kind of those social settings. There has been, lastly on here, there was a study done out of China, kind of looking at those smokers versus non-smokers who did end up having COVID-19 or the coronavirus. And they did find that tobacco users were 14 times more likely to have a worse progression and required a lot more extensive treatment and hospitalization because of that compromised lung health. And so I think that's a pretty big number when you're looking at, those who smoke versus not smoke. I mean, anything that's 14 times more likely, that's a pretty big number. And so thinking through of the people that we know, that we love, whether it's adults in our lives or the, teens in our lives, thinking through those who may engage in smoking or vaping, this is pretty serious for them. And I've seen a number of different campaigns now in the various tobacco-free worlds about, well, if you're going to quit smoking, now's the time. Not that most times are good to stop, but especially now, because you are putting yourself at a much greater risk if you are a smoker in what is currently going on. So now we're going to talk a little bit about adolescent substance use and the risk factors for teens engaging in substance use. So like I had said at the beginning, we want to look at, if you are a current user, whether you're a teen or an adult, how does that put you at higher risk for coronavirus? But then also now we want to kind of switch gears and talk a little bit about, okay, say your teens are fine, socially isolating, socially distancing, following all the precautions, minimizing the risk of exposure. What are some of the risk factors then of our teens turning to substance use to kind of cope with everything that's going on? And so we're going to look very briefly at what some of those risk factors are, and then go a little more in depth into some of these. So this is a list of some of the known risk factors that may lead a teen to using substances. Looking at family history of use, addiction is definitely genetic. If someone in your family has a substance use disorder, then that does put you at a greater risk of developing a substance use disorder. Favorable parental attitudes. So if parents accept and are fine or supportive regarding substance use, then teens are more likely to use. Lack of parental monitoring, which may be a little more difficult right now. Parental substance use. So if parents or other adults living in the household are using, that puts the teen at a greater risk of use. If there is any sort of rejection of sexual orientation and gender identity, which, for some of our teens right now, if this is something that they are working through, or if they've worked through it, but their family hasn't, when they're around their family or their parents who aren't accepting of that, that could be very challenging right now, especially right now, because they don't necessarily have their resources or supports outside of the home for them. Definitely association with other substance using peers, lack of school connectedness, low academic achievement, childhood sexual abuse, and also some of those mental health issues like depression, anxiety, things like that. So the ones that kind of jump out to me that are a little more prevalent right now, I think during this pandemic, is that family history of substance use, since that's not something we can change. Parental substance use. And with this, in the last 2 months, I've seen so many things on social media and different memes, and you're hearing about how alcohol sales have soared. In Illinois, the cannabis industry was considered an essential business. So we're definitely hearing about an increase in adult substance use right now. And so, if our teens are being exposed to their parents maybe drinking more than they would normally, or using, kind of turning to substances to cope with everything that's going on right now, that is something that could increase the risk of our teens using. The lack of school connectedness is another big one right now. Obviously, our teens, any of our kids, are not in school right now. And not only is school a place for academics, obviously, but there is that social connectedness, not only with their peers, but with their teachers. School provides so many protective factors for our kids. And for many of our kids, it can provide kind of basic needs like food that they may not have access to right now. And so all of those things definitely kind of, that one jumps out at me, because our kids, it's more difficult for them to be connected, even though e-learning is in full swing and, you know, there's Zoom meetings and Google Hangouts and all of those things. It's not quite the same right now for our kids, and those who really rely on school and all of the resources that school provides, it can be very challenging for them. And so that is definitely one of those risk factors right now that we're paying attention to. And then lastly, one of the other ones are those mental health issues. You know, teens who may not have had mental health issues prior, and this is bringing on mental health issues, or those who, you know, have been struggling and dealing with and working with mental health issues. You know, how are they being impacted now, with probably fewer resources and fewer supports. It's great that so many of our local agencies can do telehealth now and do therapy, you know, via Zoom and all of that stuff. But it definitely is a struggle for those who have some of those mental health issues. So specifically stress and anxiety. So we definitely know that there are many positives about stress and even anxiety. It's a very basic thing that we have. It's kind of a part of our survival for our bodies, is to feel stress and anxiety. It activates that central nervous system. And, you know, that is what gives us that fight, flight, or freeze response. So when we're confronted with a stressful situation, you know, that's when we either figure out how to fight, or we run away, or we just have no clue what to do and just completely stop doing whatever it is that we're doing. And that serves as a very good function in a lot of situations. Back in the day, you know, back in caveman time, that's what kept people alive. Luckily, not so much that's needed now, but you know, stress and anxiety does serve a purpose, and it can be helpful in many, many ways. You know, we hear from our teens that, you know, when they have that, you know, little bit of stress, it really can help them focus and concentrate if they have tests or papers or college applications or whatever the situation may be. It can really help them focus and work hard on what it is that they're doing and what's important to them. And it can really help them prioritize what needs their attention, helps them kind of keep out distractions, helps them, keep those priorities in line, so that they can do what they need to do. And I hear that, you know, from adults too. I mean, even for myself, when I have a lot going on, I'm more productive because I'm more focused and can concentrate. And it's that stress that allows us to kind of function in those helpful ways. So stress and anxiety can absolutely be helpful. However, it can very quickly become unhelpful and unhealthy when it becomes overwhelming, or when it's this chronic, ongoing thing. Then it does the opposite of what we want it to do. It definitely reduces the ability to focus and concentrate and problem solve. You know, and thinking about our teens and their underdeveloped brain, when that happens, you know, since their prefrontal cortex and their executive functioning skills are not fully developed, when all of a sudden they have too much stress and are overwhelmed with their stress and anxiety, then they don't know what to do, and they can't focus, and they can't problem solve, and they have a really, really hard time getting through even the simplest of situations. And even among teens, it can also cause changes in their brain wiring and changes in how their brain actually functions, in those connections in their brain, which can absolutely impact them long term. And we see that when a lot of times when teens are turning to some of those unhelpful negative coping skills, and, turning to those, things like substance use and risk-taking behaviors. So when we're looking at a teen and trying to figure out, okay, is their stress and anxiety manageable? Is it in the healthy stage, or, have they moved into that unhealthy, overloaded, concerning stage of stress and anxiety? So there's a number of different things that we can look at from a physiological perspective, cognitive perspective, emotional, and as well as behavioral. And stress and anxiety impact all of these areas. So when someone is stressed, you can feel it in your body. Absolutely muscle tension and appetite changes. And if, they're having a hard time sleeping or complaining of stomach aches or headaches, or see that lack of energy or overly restless and can't sit still, there's so many physical things that can happen when someone is under stress. Cognitive ability, like we've kind of already talked about, that inability to pay attention, difficulty focusing, reduced problem solving, etc. Emotional, and I think there's a lot of emotions going on in the world right now. So this might be difficult to tease out, is this stress and anxiety or is this other stuff? But when, we're seeing anger and irritability, sadness, hopelessness, helplessness, them feeling like they can't even do things that they normally could. Some of these things. And then we're also seeing that behavioral component. So isolating themselves even more, starting bad habits, that substance use component, risk-taking behaviors, self-harm, aggression, some of those more outward, visible things that we're seeing. And, the thing with a lot of these signs and symptoms is some of these may be more the norm for some teens than others. But the really important thing is, as parents and those who work closely with teens, what their baseline is. How they are normally, how they normally handle stress. So when all of a sudden things are kind of off their baseline and things are more than normal or less than normal, and there's a pretty significant change or any sort of change in any of these areas, that's a reason to be concerned and a reason to want to kind of engage and definitely intervene and do something about it. So, because it is very personal. So one teen is going to look one way, another teen is going to look another way. Definitely, I'm sure in families, siblings are going to respond differently. And so it's really about, like I said, knowing where the teen in your life is, what their baseline is, and how they typically handle stress. And then especially right now, if there is a pretty significant change in any of these areas. So some of the unhealthy coping habits that we want to watch out for, and similarly to what was on the previous slide, are they withdrawing even more, having meltdowns, avoidance, etc. I have a almost 3-year-old, and his meltdowns have certainly increased since all of this started. Some of his might be developmental, but I've definitely noticed that in my 3-year-old. If there's something doesn't go quite right, it's whole freak out. So it happens at all ages. For our teens, if there's more arguments, like more of those excessive behaviors, excessive gaming and social media, or increase in sleeping, excessive eating. Again, those self-harm behaviors, so like cutting and that type of thing, as well as substance use. So about the substance use, we definitely know that teens who experience a lot of stress, 3 times more likely to use marijuana, twice as likely to use alcohol, and about twice as likely to use tobacco. And so not only does our research show that, but our own local data about our own students at District 225 also shows that. We do know from our data that our students who report experiencing stress and anxiety and other mental health issues like depression, their rates of substance use across all substances, alcohol, cannabis, tobacco, etc., are higher than those students who do not report experiencing that stress and anxiety and other mental health concerns. So definitely that stress puts our kids at a higher risk of use. So one of the other components to talk about is trauma. And I think we can all agree that what is happening right now can be very traumatizing. And disasters and pandemics and things of this nature definitely trigger many emotional, cognitive, behavioral responses. And this kind of goes back to that stress and anxiety. Again, going back to that fight, flight, or freeze, some shock, some denial. And I think it's really important to know that trauma is very much a personal experience. We're all experiencing similar things, but how we interpret those things is what leads to that trauma. You know, we all could experience the exact same event. We could all witness or be a part of, let's say, the same car crash, but we're all not going to be traumatized by it. Or if we are traumatized by it, it's not always going to be the same. So even though a lot of our kids are experiencing very similar situations with not being able to go to school, being stuck at home, not being able to see their friends, how they interpret that is really what's leading to them experiencing trauma or not. And I think, you know, this is a list that I just kind of came up with thinking about what our teens are going through right now and what could potentially be traumatic experiences for them. You know, for our teens, and I mean, I think these can probably be applicable for any of us as adults too, you know, if we have family as some of the frontline workers, whether in the medical profession or working for the grocery stores or, you know, whatever. And so if you have a family member who is one of those workers, it can be really, really scary about, you know, if they're exposed, if they come home and then you get exposed. There's lots and lots of things to be worried about when you have someone close to you who is a frontline worker. Family who have had coronavirus or who has been exposed to it and, you know, who may have been in the hospital. And then obviously if, you know, a family member passes away because of that, families out of work. You know, we hear in the news so many numbers, high, crazy numbers of unemployment, people furloughed, and all of that. So that can definitely lead to a traumatic experience for the teen, because if their parents aren't able to provide for the family, then what does that lead to? That could, you know, lead to lack of resources, you know, if they don't know where their next meal is coming from, or if, you know, their parents aren't able to pay their mortgage or pay their rent, pay their bills, etc. That can definitely lead to some traumatizing experiences. That lack of social connection, which we'll talk about in our next couple slides. Missing important school and life milestones, you know, thinking about all of the seniors in high school who are supposed to be graduating and going to prom and experiencing all of those things that they have looked forward to for so long, or all of those kids who in the last couple months have turned 16 and can't go to the DMV and get their license. You know, so things that to us as adults, it's like, yeah, you'll get over it, it'll be fine. Those are really important to our teens, and that can definitely lead to some trauma for them. You know, if our teens have a difficult home life, you know, I've heard so much more and seen so many more resources and research about, you know, if there is a domestic violence situation or if there is some sort of abuse situation in the home, and if you can't get away from that, what that can do to our teens. Like I've said a few times, family substance use, you know, whether it's getting to a more significant nature, you know, maybe mom or dad is using those substances at a much higher frequency, using significant more amounts, etc. That can definitely be traumatizing for our teens. And then just the uncertainty and unknown future. No one knows what's going to happen tomorrow or next week or next month, and what our lives are going to look like. And, you know, so that uncertainty can be really difficult for our teens. Are seniors going to be actually going to college in the fall, or are they going to be having e-learning, for the start of their freshman year of college, and our eighth graders transitioning to high school? And there's so much uncertainty that our teens may struggle with. So just lastly about trauma, we do know that those who have previously experienced trauma, that past trauma may reemerge when there's new trauma experienced, especially when it's prolonged, like we're going through. And the research definitely shows the strong link between those who are experiencing trauma and as far as, having post-traumatic stress disorder and substance use. We hear from teens, about stress and anxiety, how they use substances to cope with that. And it's, the exact same thing with trauma. People use drugs and alcohol for that distraction, for that relief, to cope, to get away, to escape from what's going on, even though it is only a short time and it doesn't last for long, and that trauma is still there when the effects of the, alcohol or drugs wears off. That escape is what, they're really looking for. And so, we know that adolescents who have, officially PTSD are 4 times more likely to experience alcohol abuse or dependence, 6 times more likely to experience marijuana abuse or dependence, and 9 times more likely to experience much more significant drug use, like, hard drugs would be like cocaine or heroin or meth or things of that nature. So they definitely are more at risk when they are experiencing those things. So social isolation. This is kind of the last risk factor that I want to talk about in the next few minutes. So definitely connections with peers is super important for a teen's healthy development. I'm sure all of us who have had a teen or work with teens have seen that shift from, focusing on the family unit to really focusing on that social friendship unit as kind of helping really frame their behaviors and their identity and really help them figure out who they are as a person. And right now, our teens have no choice but to be socially isolated. You can only do so much through a computer screen or from, across the street or, however long. And this definitely brings about some of those mental health concerns, and some of, this leads to some of that trauma and that stress and that anxiety. And so we want to really think about, how our teens are handling this, because they rely so much on their social relationships, and how being alone and disconnected and disengaged really is impacting them. And we definitely know from research that substance use is higher among teens who are feeling socially isolated. If they use that, and those negative feelings are then used, the alcohol or other substances are used to kind of cope and self-medicate with those negative feelings. There are definitely those teens in the world right now who are, introverts and super happy that they don't have to engage in social situations. But I would say that's not the norm. So really looking at if this significant isolation is leading to those negative feelings. In the addiction treatment world, one of the big things, and this is why you see, AA and group therapy, family therapy, all of those types of things, is because when someone is experiencing addiction or is experiencing a substance use disorder, oftentimes they end up being socially isolated, either by choice, because of their behaviors, or because their behaviors have driven their family and friends away. And so when someone does have a substance use disorder, is, significantly using substances, one of the really important things is that connection and those relationships to other people. And so right now, if there is a teen in your life who may be struggling with substance use, that lack of connection can also make it worse, which is not a good thing. And then one of the other things, going back to that mental health component, when you're feeling lonely and socially isolated and, may or may not be, feeling some depression or that anxiety, it's easy to run out of hope. And then it's easy to, turn to substances to cope with those, negative feelings, and kind of self-medicate that way. So definitely can lead to that. I've also heard then kind of on the flip side, that, well, there aren't parties happening. Teens aren't going to social functions and being exposed to alcohol and getting access to, alcohol and other drugs. And, because a lot of our teens that, have used in the past, it may be just a very social thing. And so because you're taking away that social component, now they're not using. However, everything that we have talked about can then lead them to using, regardless of whether it's socially or alone. So in the last, I was running out of time. So this is this FACE COVID acronym that I'm going to go over. So this was developed by Dr. Russ Harris. He is out of Australia, and he is a doctor. He's a medical professional, as well as now a therapist, and he really focuses on acceptance and commitment therapy. And so he kind of created this acronym to really help adults and teens to kind of cope and manage everything that's going on with COVID. So with the acceptance and commitment therapy, it's very much focused on cognitive behavioral techniques and mindfulness. And so if you're familiar with either of those, some of these phrases will definitely look familiar, but I think this is a really useful kind of takeaway and something to easily remember when supporting our teens through all of this. So the F, it stands for focus on what's in your control. And I think that's so hard for all of us right now because there's so much that's not in our control. And so helping our teens think through what they actually can control, and help them kind of focus on that can be really, really helpful, because if we focus on what we can't control, then it's really easy to become stressed and overwhelmed and anxious and kind of go off and not know what to do. So when we can actually focus on what we can control, that's really important. So we can control our own behaviors, and we can control what we do in our house. We can control, maybe to some extent, when we do our schoolwork, depending. But it's not helpful to focus on, what the state of Illinois is doing, or what the United States is doing, or what the coronavirus is doing. We can't control that. So really helping our teens and ourselves focus on what we actually can control. The A stands for acknowledge youth thoughts and feelings. And we all are experiencing many different feelings right now. And so really making sure that we're acknowledging and validating and having compassion for those feelings, whether it's frustration or disappointment or boredom or loneliness or anxiety or loss or stress, or there can be a whole slew of emotions and feelings and thoughts. So definitely taking the time to acknowledge that and validate those feelings, because that, it's always helpful when someone says, I hear you, I get it, I understand you're feeling this way, and that's okay. And then kind of moving from there. So the C stands for come back into your body. So this is what we call grounding. And this is very much in the mindfulness world, something that happens a lot in mindfulness. And so this is really paying attention and connecting with your own body, and not just like going out and exercising. It's, sitting and paying attention to, okay, where is my muscles tensing? or can I feel my feet on the floor? Or can I, feel my back up against the chair? It just really helps to bring us into the present. And it really helps people to kind of going back to that focusing what's in your control, just kind of bringing you back to the present, bringing you in the here and now, and focusing just on you, and not everything else that's going on in the world. Some people are better at this than others. I personally am terrible at this, but other people find it incredibly useful, and really helps them kind of recenter themselves and refocus on what's going on. The E is engage in what you are doing. So really paying attention, like the C was paying attention to your body. The E is really engaged in what's going on in your immediate space. What do you see? What do you hear? What do you smell? Thinking about those five senses. And really just focusing on being present and what's in that here and now, and engage in that fully without kind of those thoughts wandering to all of those things that you can't control. And that kind of also leads to that committed action. So making sure the things that we're doing are intentional, and really focused on kind of our values and our priorities and being committed to whatever that is. It could be committing to your sleep or committing to eating or committing to whatever, but whatever it is you're doing, you're fully engaged, like the E, and then committed to that. Then the O stands for opening up. So being open to all of those feelings and thoughts that are hard. Going back to, being able to acknowledge those thoughts and feelings, and then being able to open up and be okay with them. A lot of times we don't have control over our emotions. We feel them, and they're not always pleasant and they're not always positive, but being open to those and then figuring out what to do with them kind of comes next. But the first thing, again, going back to that, acknowledging those thoughts and feelings is then opening up and being willing to have those feelings, even when they're difficult. Values, like I kind of mentioned with that committed action, what are your values? What are the things that are important to you right now? If, things like relationships are important, be intentional about texting or FaceTiming or Zoom calling with those friends and family members. If humor is something that you value, making sure that you're doing something that brings you humor in your day. So whatever those values are, making sure that those are still in your life and that you can still even use those to those around you, which is really important. I identify resources, whether that's social resources or, needs-based resources like knowing how to access the Northfield food pantry, or knowing how, if you need help with this, that, and the next thing, knowing what those resources are, knowing what the school resources are, etc. So being able to identify those. And then lastly, because we're talking about coronavirus, disinfect and distance, making sure, we're doing what we need to do in various, situations when we leave our house to make sure that we're not putting ourselves at more of a risk for potentially contracting the virus. So, following all of the guidelines, by the CDC, by the, state of Illinois, et cetera, about that. So those are some things that, hopefully a couple of these stand out to you that, the teen in your life or yourself could potentially benefit from, but just kind of keeping these things in mind to help through all of that's going on. More specifically, regarding substance use, Partnership for Drug-Free Kids has a really great list of things with additional resources about, during this crazy time, how can you still talk to your kid, decrease those risks of them turning to substances, to cope and self-medicate with all of this. And, all of these can speak to ourselves as well as our teens. And I think a lot of these are really important to keep in mind and really try and practice. I know I've seen various lists like this all over the place. The one that I appreciate, I think the most for me, is give yourself a break. Like, all of us are struggling, all of us have issues, and it's okay. And you can just give yourself a break. And also for me, those of you who know me, I definitely appreciate keeping a structure and a sort of daily routine, which is really helpful. One of the fun ones, I think, is take interest in their interests. I've seen this in my house with my 6-year-old. She is only 6, so she is not the best dancer in the world, but she likes to have dance parties. And so a lot of times, dinner time and right after dinner, we have dance parties. And my husband, who is a terrible dancer, he learned how to floss, the dance move, for her. And it's just been so fun to kind of see her be so excited about him learning a new dance and then being able to dance together. And, it's not something he normally would have done. But kind of through all this, he's like, I'm going to learn how to floss. And so they're able to experience that together, which has been really fun to see. And I think also limiting news and current events is really important. Obviously, we need to keep up with what's going on. But it's also really easy to get sucked into the constant gloom and doom messaging that's out there, with our 24-hour news channels and our, news feeds on our phones and just all of that. We need to stay up to date and current, but, we also need to know when to shut it off. So these are some other great resources. These are all links. So when I send out the presentation later today or tomorrow, you'll be able to access all of these. These are really great online supports for those experiencing some sort of substance use concerns or issues. I would say most of these have figured out how to do virtual classes or virtual groups or virtual resources, which is really great. There's tons of AA meetings online now, which is wonderful. There's a couple podcasts that I have listed here, which can be helpful. These are some mental health resources and some apps that can be really helpful for our teens. Some of the teens that we work with, these are ones that they've recommended and that they've used, and that just really kind of help some of those mental health concerns. But yeah, these different mental health resources have a variety of things about supporting the mental health of our teens during this pandemic. So I did terrible at leaving time for questions. So let me see if there are any. Doesn't look like there are. So I guess timing works out well. Like I mentioned, we will be sending out the presentation slides to those of you who joined us, as well as a link to a short evaluation, which will greatly help us in any future presentations and webinars that we will do. So thank you so much for attending. And it is just about 2 o'clock. So I hope everyone enjoys the rest of their day, stay safe, stays healthy, and definitely feel free to reach out to GNCY. I did not, well, you'll get an email from me, so you'll get my contact info. If you have any other questions, and then also next week, same time, next Wednesday, we have a webinar from our clinical director at Peer Services about adolescent substance use, really looking at those signs and symptoms, those withdrawal factors, treatment, and how parents can support teens who are experiencing substance use issues. So please sign up for that if you haven't already, and thank you so much for joining us.